Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a golden retriever who is 5 years, who has got one chest wall growth, and today we are operating. So we have done CT scan few days before, and you can see that this is the mass inside the chest cavity. So we were able to see this mass slightly outside, and but it was even 60% this mass is inside the chest cavity also, and it's in the caudal aspect of the rib area. We are planning to do the surgery, and we are going to resect almost 3 ribs. I'll show you the planning and all. So if you'll see here, because in these cases whether I need to put my mesh or not, it depends upon these muscles. So if you'll see, this is rectus abdominis muscle, which will help me to close this area once I remove this and once I cut all these ribs. This is external abdominal oblique muscle. This is the oblique muscle. So these 2 muscles I am going to separate from here, and then I am going to open and go for removal. If we go backside towards the abdomen cavity, this is the contrast image of the liver. This is the gallbladder, this is the stomach, and this area is the spleen. Here is the spleen. This is the whole area. This is the duodenum, and this is pancreas. If you see the pancreas, this is the pancreas. This area is pancreas. But if you see on the ventral aspect of the body, there is one growth is sitting here. Most probably it is a lymph node, or it is a growth in the omentum area somewhere. Growth is there. We are not sure completely why this structure is there, but probably we are going to remove this also during the same surgery. In this case, what I am going to do most probably that, I'm sorry, 1 minute, I need to, it has gone in different window, 1 second, okay. So in this surgery, if you'll see the growth is just in front of the diaphragm. So diaphragm is starting from here. This is the area where diaphragm is there. So probably this must be attached to diaphragm. So some part of the diaphragm I am going to remove, and probably I'll suture the diaphragm to the cranial ribs so that I don't get a flail chest condition. That will be easier for me because this is on the outer, on the last ribs. If I go to the 3D view of the same thing image, you can see this is the area where the tumor is there. These 3 ribs are affected, and if I go and change this, you can see this is the growth. You can see here, and growth is sitting 1, 2, 3. 3 ribs I am going to remove so that I can get good margins also. So this is 13, 12, 11, 10, 9. So I am going to remove 8, 7, 6, all 3 ribs I am going to remove at osteochondral junction. I am going to remove, and we have done a final aspiration for this, and we found that this is a sarcoma, and to me it looks like more of it's a chondrosarcoma, but it can be osteosarcoma also. Once we remove, we are going to send for the biopsies. So my aim is to remove all these 3 ribs from here, and in case if I get a proper positioning of the diaphragm, I am going to attach, rather than attaching the diaphragm on this ribs, I am going to pull the diaphragm and probably attach to this area. But that is during the surgery. I need to decide whether I have a option of doing that. Otherwise, we'll just put the rectus muscle and external abdominal oblique muscle over this area, and we'll close it. So I don't think I need to put a mesh in this case. But still, maybe I'm going to keep my mesh ready for me to use in case required. So this is about this surgery, how we are going to plan it. So in some time we are starting this surgery, and I'll put this both the things on YouTube. You can see that. Yeah. Thank you.